Hi everyone, my name is Kyle Painter and I am here to discuss the effects that concussions have on athletes both in the short and the long term. So first off, a concussion is a traumatic brain injury that actually causes the brain to hit the side of the skull. This is caused by either a direct blow to the head or a whiplash effect of the head. Now, researchers that would do experiments on this had a tough time finding subjects to include in their study. But there are many studies done surrounding this topic, which added to the credibility of the conclusions because they were all the same. Now, what these researchers found was that in the long term, concussions lead to depression, anxiety, aggression. Some cognitive disorders are memory loss and slower reaction time. And they also found that the more concussions one sustains, the increased severity of the symptoms. For example, one study found that players with 3 or more concussions had much more severe depression than those who had 1 concussion. Now, the short-term symptoms are sensitivity to light, headaches, vomiting, and nausea, and the mental symptoms can be forgetfulness and difficulty concentrating. Now, a normal athlete is given 7 to 10 days to recover from these symptoms before they are asked to return to their sport or work or school. Now, these researchers found that the physical symptoms can last up to 3 months, and the mental symptoms can last even longer. Clearly, we are not allowing these players enough time to recover, especially with a brain injury, which is much more crucial than maybe a broken bone. So what we have to do is we have to allow these players more time to recover. We have to give them maybe a month or 2 months. Let them fully recover from this concussion because it may decrease the effects in the long term. There isn't much research done, so we would need to see how much time is needed to actually fully recover from these concussions. But once we find that, say it is a month, we can do a longitudinal study and see how these athletes are further down in life. Do they have that severe depression, anxiety, maybe the cognitive disorders, or because they were allowed to fully recover, they don't have any of those symptoms anymore? So I would love for some of you to go out there and do this research and maybe improve the treatment of concussion so our athletes are much more healthy and maybe can even play longer. And right here is just, if in doubt, sit it out, and hopefully athletes take this. If you are hurt, if you feel fuzzy, just take yourself out of the game. Coaches and athletic trainers, if you see a player showing symptoms, just take them out. Their health is more important. So hopefully we'll see strides in the improvement of treatment of concussions very soon. Thank you very much.